I want to present these today to give you an idea of some of the data that we look at by geography on an ongoing basis and have been using to help us direct where we know transmission is happening in communities, but also our immunization and outbreak response programs. So this one shows the average daily rate of new cases per 100,000 population. So this is a rate of where we're seeing the most transmission in communities around the province for the week of April 7th to 13th. What stands out here, of course, is the local health area called Howe Sound, and that includes Whistler. And this was one of the pieces of information that we used to address the outbreaks that were happening in Whistler since January. And we've seen this rate fluctuate because of the outbreak measures that were taken there. And it is one of the things that we use that help drive the decision to provide immunization to workers in the community in Whistler. We've seen ongoing high rates of transmission in Surrey. That's something that's been steadily a high transmission area through most of the pandemic. And of course, you can see here that Peace River South, which includes places like Dawson, are showing up right now, as well as Windermere and Revelstoke in parts of the interior. The next dot plot is total case counts. So the two of these taken together give us an understanding of where rates of transmission are highest, but also the burden of COVID-19 in different communities. So these are two of the pieces of information that we have been using over the last months and weeks to try and direct particularly our outbreak response programs, and that includes things like rapid testing, having increased testing available in certain communities, and also now immunization. And this is why we are focusing, for example, our worker program, which we have started up. Initially, we were using the AstraZeneca, the Covishield vaccine, to target these communities and people who were in higher risk workplaces that we've identified. We're now using this to ensure that we are targeting the key workplaces where we're seeing transmission and where we need to protect people like our first responders. So we've seen transmission in Surrey, for example, and that's why we're focused on fire and police services starting in Surrey, starting in some of the other higher risk communities as well. And that will, over the next few weeks, and ensure that we're able to, by area of risk, provide vaccination to all first responders. We've also been using this type of data about where risk is greatest to target our school and childcare worker program as well. And as you know, we started in Surrey with the Surrey School District for these very reasons, that we know that the risks of transmission in the communities are highest in the Surrey School District, and we'll present some more information on that. So I just want this information to be out there so that people understand how we're making some of those decisions, sometimes very rapidly, as we see developing cases happen in different communities around the province. Going back to some of our epidemiologic data, this is the daily cases, hospitalizations, and deaths by date of report. And what we can see in the green at the top is that we had a dramatic increase in the third week of March. And this was during the period of time in the middle of the spring break where we started to see a lot more social connections and activity and movement of people. And this has led, along with the fact that we have higher transmissible variants of the virus circulating in communities, to a dramatic increase. We are starting to see a slight blunting of that in the last week due to the actions that we took about 10 days ago. What is also concerning and a lagging indicator is the increase in hospitalizations that we've seen in the past 2 weeks. On a positive note, we've seen a dramatic decrease in the rates of death, and that is important as well, and is testament to how well the vaccine is working at protecting people. And we'll talk a bit more about the hospitalizations and why we're targeting our immunization programs where we are in a minute. The next epidemic curve shows our cases by health authority, and not surprisingly, there's a large proportion of cases are in the Fraser health region, although we have seen increases across the board in the last few weeks. This is the epidemic curve by source of where we believe people have acquired their illness, and this is by date of onset of illness, so it looks slightly different than what we saw previously. And as we can see, as we've had this dramatic increase in numbers of cases, it's been challenging to predict where people, or to determine where people were exposed to COVID-19. And that gives us also an indicator of broader transmission in the community. It's one of those things that we look at very carefully about if people are if cases are arising where we don't link them to a known case or cluster. And this is happening more commonly in the past 2 weeks. This is an important slide. It looks at our daily case count by age. And as we have seen and been talking about for the last few weeks, we've seen a dramatic increase, particularly in the 19 to 39-year age group. We've also seen increases in the 40 to 59-year age group, and 60 to 79 and the 5 to 18 as well. But the largest and steepest increase has been in younger people, both from social connections but also from work connections. And we know that those interact in what we call social networks. But what we are seeing is that those social connections, where people bring it into a home, where before, if there were 10 people in a household, we might see transmission to 2 or 3 other people at most. Now we're seeing, with the new variants in particular, that transmission can be widespread in households. It may be that all of the household becomes affected, and it's the 40 or 50-year-old parent who ends up in hospital. And this has been played out particularly in the Lower Mainland, but we're seeing it now increasingly in other parts of the province as well. When we look at our daily case rates by health authority, we can see that that things are really driven by Fraser Health and Vancouver Coastal. We've had high rates across the north for some time, and those have been leveling off and coming down. Some of the other important metrics that we look at carefully are the percent of people who are testing positive every day, and that rose quite high to around 12% in the province. It's slowly starting to decrease again, which is good news, but the numbers are still, of course, very high. This is a summary that shows you the impact of the immunization program by age, and most importantly, we can see how protective the vaccination program is against hospitalization, but most importantly as well, deaths in older people as the immunization program has been ramped up. And that is what we are looking at for the coming weeks and months. We've been talking a lot in the last little while and watching carefully about hospitalizations, and younger people are in hospital, and by younger people we've seen an increase particularly in people 40 to 59 who've ended up in hospital in the last few weeks, in particular since the middle end of March. We've also seen a rise in the 60 to 79-year-old age group. That has been the numbers that have been highest in historically, the 60 to 79. We've seen a leveling off and a pretty steady rate of people over age 80. And while we have seen a slight increase in people 20 to 39 who need hospitalization, and the rates in that group remain relatively low. So really what we're looking at is hospitalization is now being driven by people between the ages of 40 and 79, and that's why it is so important that we continue to focus our age-based immunization program on those down to age 40 in particular. But we know that this vaccine not only protects against some transmission, but very importantly protects against severe infections, hospitalizations, and deaths. This is just another representation of that, which shows that we are seeing hospitalizations increase the 40 to 59, 60 to 79, but deaths are pretty much concentrated on the older age groups, and they've come down overall with the immunization of older people, but we need to focus on trying to prevent transmission and illness in that age group continually. Again, this is an updating of the percentage of our cases and hospitalizations, and it shows that we continue to have lower numbers of cases compared to the population in the younger age groups, which is good news. That we have seen an increase in 20 to 29 in people who are sick with COVID, but really the dramatic increase that we've seen in hospitalizations continues to be driven by people over age 50 and people in ICU over age 60. We've been adjusting our strategy around variants and their impact in our population, and I've talked about how we are going to be moving from presenting numbers out of context and including this in our surveillance reporting going forward. What we have here is just a representation over the last few months since variants were really became an issue that we needed to understand. We have been doing whole genome sequencing to confirm, so that's the only way to know for sure that a variant is one or the other. And we've had a number of tests that have been developed in different laboratories in the province that test for specific mutations. We now know that certain combinations of mutations are associated with certain of the variants of concern. In particular, we have a pretty good screening test now for B117, which is a large proportion of the variants that we're seeing causing disease in BC right now. So we no longer need to do whole genome sequencing on all of the people who screen positive for the B117. We will continue to do a sample of 5 to 10% of the ones who screen positive for that combination of mutations over time. And we will continue to look at all of the people who screen positive for the P1. And the reason for that is the types of tests, the screening tests that we have for other variants look for mutations that are common to many different variants. So you can't tell for sure if it's a P1 or a B1351 just by the screening test. So we'll continue to do whole genome sequencing on all of those so that we're not missing any new variants that come up that may be important in terms of transmission in the province. And we're going to now, we have moved now as well to doing a random sample of tests from around the province that are positive COVID tests from around the province and doing whole genome sequencing on those, so we have an understanding of what proportion of different variants we're seeing in different parts of the province and are able to detect if new ones of concern arise. As well, we'll continue to use our whole genome sequencing to help us understand outbreaks that are happening in different settings around the province, and that's been very helpful for us from the very beginning, as well as making sure that we're able to understand if people are getting sick after vaccination, whether there's a reason to be concerned about a specific variant. So that is our strategy for identifying and understanding what's happening with the changing viruses that are causing infection in British Columbia for the future. And what will show up is this type of information in our weekly surveillance summary that's posted on the BC CDC website every Wednesday morning. And this will give us an ongoing look at where we are in terms of variants across the province and which ones are causing most illness. And as you can see, looking at the week that ended on April 10th, we're up to just under 60% of cases in the province are likely a variant of concern versus the other types of other virus strains that are still causing infection. And so that's that green line. When we look at what ones were causing infections in British Columbia, the two that have a high transmissibility are P1 and B117 that are predominating, but it's not equal in every part of the province. And this gives you an estimation of, though it might be 50-50 almost, at a provincial level, by geography, what we're seeing is that in the Fraser Health region, the number of, the percent of cases that are caused by a variant is slightly over 60%, and the majority of those are the B117. And the picture is slightly different in Vancouver Coastal Health, where we've had a number of different introductions of P1 and transmission chains in different areas of Vancouver Coastal. And in Vancouver Coastal, over 70% of new cases are caused by one of the variants of concern, and the most common one is the P1. When we look at other parts of the province, the proportion of variants causing illness varies and is much less, and it is varied primarily the B117. So this is the information that we are going to be using going forward to help us understand which types of the virus, which variants of the virus are causing illness across BC. I now want to give a little bit of information of some of the summary data that we've put together, focusing on Vancouver Coastal and Fraser Health, the largest school districts, to understand what's happening in our school settings over the past year. So this is an overall graph that shows on the top all ages, so people who've been infected with COVID-19, so that's the overall epidemic curve. And on the bottom in the gray is students between the ages of people between the ages of 5 to 18 years. What we saw on September 10th is the start of school, and then the two gray bars represent the winter break and the spring break that we've seen recently. In both cases, we saw an increase in cases in the community during those holiday seasons. Those holiday weeks, and particularly in the spring break that we've just seen in March, we saw an increase both in overall cases in the middle of that, as well as in cases in young people. And that, of course, has led to increased exposure events in schools when the spring break ended 2 weeks ago. Overall, we still have a relatively low infection rate amongst school-age children relative to their proportion of the population, and that's particularly true for ages 5 to 12, where it's still underrepresented. In the last few weeks, we've seen transmission in people ages 13 to 18, and that has caught up to the percent of the population. Other things that we watch very carefully, of course, are deaths and hospitalization in school-age children. We continue to see that school-age children are less likely to be infected with COVID. It's about 1 in 200 who require hospitalization. So again, a tenfold decrease from adults. So we have all along tried to find ways to understand in more detail the investigations that are done in schools. And so what I'm going to present is just an overview of two of the in-depth reviews that have been done. The first in Vancouver Coastal was done between September and December, so when school started last September up until the Christmas break. And the second, in a very similar way, was done by the Fraser Health Authority for schools in Fraser Health starting in January and ending with the spring break. So this is these data are from the detailed case investigations and contact tracing and outbreak and cluster investigations that are done for every exposure event in schools. So when we look at the findings from Vancouver Coastal Health, we're talking about 124,000 students and staff who were in the school system. So it was excluding students who were homeschooled or who were doing remote learning. And we had 699 COVID cases amongst the students and staff that were participating in in-school learning. And 3/4 were in students and 1/4 were in staff. So less than 1% of the 124,000 students and staff who were in schools were cases of COVID between September and December. Of that 699, 55 were cases were people who likely acquired their COVID in the school setting. So that is reassuring to us. About 8% of these cases were acquired whilst in school. And typically when a transmission did occur in a school, on average, that led to 1 or at most 2 additional cases in the school. So this tells us, importantly, that despite what was happening in the community, that schools are a relatively low transmission environment, and that the measures that are in place in Vancouver coastal schools during that period of time were effective in preventing widespread transmission in the school setting. This is a summary of the cases in schools and students and staff cases relative to cases in the community in Vancouver coastal. So the top dotted line is cases in the community, and as we see with the spring break start and stop, we had a rapid rise in cases in the community. We saw that rise as well in student and staff cases, but that has leveled off and started to decrease once school started again after the spring break. It did, however, lead to quite a number of potential exposure events in the schools after spring break. The second study is a very similar analysis that was done in the Fraser Health region, and it involved 315,000 staff and students in the Fraser Health region. And we know that in that period of time we had very high rates of transmission in some communities, in particular in Surrey and North Delta and Abbotsford. Of the 315,000, slightly less than 1%, 2,049 cases of COVID-19 were identified among students, the majority of them students, about 83%, and staff, 17%. Of those 2,000 in some cases, 267, or about 13%, were associated or likely acquired in the school setting. So again, very similar to Vancouver coastal and aligned with what we saw in Vancouver coastal in the previous period. And typically when a case was identified, a transmission happened in a school is to one other person in that school setting. And importantly, no transmission was identified in 85% of schools in the Fraser region during this period of time when we know there was high transmission in the community. So again, just representing the community versus students and staff cases, it really shows us that student and staff cases follow the trends in the community, but that when they're in the structured school environment, the rates of transmission are much, much less. Having said that, it is absolutely clear that every exposure event is disruptive and concerning, and we've learned what are the measures that are important. We've been working with the schools to ensure that the COVID safety plans in every school are being followed, that people are doing what they need to do to reduce the anxiety, to reduce the probability that cohorts and even schools may need to be closed for a period of time. And that's why it is so important, and we've prioritized school staff for immunization, and starting with the areas with highest community transmission, and we'll be working through all school staff in the province over the coming weeks. So the key things that we've learned is that COVID-19 cases in schools reflect what's going on in the community around them. Most of the cases in the school setting were required outside of the school, and there was little transmission within the school itself. So it does not as well appear to be a major driver of community transmission. And I know there's a lot of talk about we need to close schools to stop transmission in the community, and we're not seeing that as an issue. So this is important for us. These are data that we've been following, we've been sharing with the school community in the regular meetings that are happening at the provincial level, because we recognize how important school is for families, for communities, and for children. So reassuring, it certainly is something we continue to pay attention to, and we know how distressing it is when we have exposure events, and we need to all continue to pay attention to what keeps things safe in the school setting. Finally, I want to update on where we are with a modeling that we look at on a weekly basis to help us understand what potential things could be happening in the future. We have been above 1 in our reproductive number for some time, and that, of course, we see in the reflection of the transmission events that we've been seeing around the province. And this has been all over BC. We have started to see a slowing or bending back down of the reproductive number, which means that people are reducing those contacts that they have where the virus can be transmitted, or those infectious transmissions. And that is important. We saw a lot of movement of people and social gatherings over the period, particularly of the spring break, that led to rapid rise in transmission. That was fueled, of course, by the fact that we have some viruses that are more easily transmitted, that are circulating in particularly the highly populous areas of the province. We see that in the Fraser health region, where it's still the reproductive number still remains high. Vancouver coastal starting to come down again with some of the actions that we've taken in the recent weeks. And we see that as well in Fraser, where reduction of even some of those settings where transmission was happening has made a difference in reducing those rates of transmission. The rates, of course, are less stable in the smaller health authorities, the less population, less transmission, but we are still seeing concerning transmission in parts of the interior, where Vancouver Island and North are coming down again, and seeing some of the important measures that we've taken in communities in the North having that positive impact on transmission. And finally, looking at where we could go in the future. So right now, the rate of infectious contacts, so the contacts we're having where the virus can be transmitted to others, on average in the province, is somewhere around 55 to 60%. That is too high. We know what we need to do to bend that back down. We need to get down to 40% or less, and we have done that consistently. We were able to do that last March. We did that in November when we put in restrictions again. And I want to remind people, the restrictions that we put in that worked in November are still in place. And I think we've all felt this need to have some of those social interactions again, and perhaps a sense of complacency around those. We need to pay attention again. We want to be able to have interactions and connections, whether it's for work, whether it's for school, whether it's for those needed social connections, in a way that is safe. And that means following COVID safety plans in workplaces. And we are focusing on those workplaces where there has been transmission, where those COVID safety plans have broken down in some cases. And we know that part of what we need to do to break those transmissions is to shut workplaces for periods of time so that ongoing transmission to that next generation can't happen. As well, we know that that travel and traveling for social connections, for recreation, for vacation, for those social interactions, are settings where we have seen transmission happen very rapidly and move back into communities. So now is our opportunity to take a step back again and get us through this next period of time as our vaccination ramps up once more. And we can see that it's not the same everywhere in the province, although we are all facing the same storm right now. And we need to make sure that we're all taking those actions to keep ourselves and our families and our communities safe. Finally, I'm just going to remind people that we do have our population health survey round 2 that is open, and please, we've had about 85,000 people who have responded, but this is your opportunity to tell us once again what are the things that are impacting you most here in BC. So together, all of the metrics that we've presented tell us some very important things. The people that you are seeing every day, whether at work, whether running errands, going for a walk, it's likely that without you or them knowing it, somebody in your community, in your connections, has COVID, may not be aware of it, and is potentially infectious. The more people you see, the higher that likelihood would be. Right now, we have a lot of transmission in communities across the province. So what does that mean? Even if we can see people outside our household, we shouldn't right now. And if we do, it needs to be the same small group of people. We know that outside is lower risk. It's not zero, but it is lower risk. So have that small group of people that you meet with, that you need to support you. Meet them outside. Keep your distance. If you're going to be in close contact, wear masks, even if it's outside. Each of us has less contact with people around us. We will all see that benefit. Even a small effort can make a big difference in our overall risk in the province. I know many, many people have been very diligent and committed to following the public health orders that we have in place. But we need now for all of us to get onto this path. And I want to thank people who are doing the right thing. But our future path is in our hands now. We know what we need to do. We need to stay close to home. We need to stay small. We need to stop those transmissions that are getting between, that we're spreading between people and bringing it home to our families, our workplaces. We know that COVID-19 is a virus that's transmitted by people to people and to the people that we are closest with. This is our third wave, and we have done this before, and we can do it again. I'm asking everybody to do our part today, to remember that we have it within us to take these small sacrifices every day to get us through this next period of time. We are not alone in this fight anymore. We have vaccines on our side, but we need to buy the time to protect those people who are ending up with severe illness and ending up in hospital right now. We need to do that to protect our hospital system, to protect our friends, our families. And we need to remember that we need to do this in this most challenging of time by being kind to each other, by remembering that we all have the issues that we're dealing with in our lives, and we may not understand everybody's story, but we all know what we need to do today, and we will get through this storm together. Thank you.